So now I'm going to turn over the microphone to Jose to kind of walk through the data and the data linkage work.
Very much, Joel. So yes, I'll start by talking about some of our current data holdings. So the data sources that are currently contained within the iPHD, and currently all of these are from the Department of Health, but we're looking to expand that as we move forward. So some of these data sources you may or may not be familiar with, and they include the mortality data, and this includes immediate, intermediate, and underlying causes of death, as well as demographic attributes of deceased, place of death. And these records are for New Jersey residents, regardless of location of death. Also included are the New Jersey birth records, which is a standardized electronic birth file that contains data elements such as setting and date and time of delivery, as well as health and demographic attributes of the newborn and the mother. We also have the all-payer hospital uniform billing records, which is hospital claims data from inpatient discharges and in-person visits made to hospital emergency and outpatient departments at New Jersey hospitals. Some of the data elements include, but are not limited to, admission and discharge dates, encounter information, such as diagnosis, patient characteristics, and associated charges for the visit. We also have the NJ COVID-19 surveillance data. So this comes from the New Jersey Communicable Disease Reporting and Surveillance System. So this is COVID-19 related data, so essentially PCR tests. So some of the data elements include dates of illness onset, lab results, and other relevant information collected from public health partners statewide, including local health departments. And we are also, for this second cycle, looking to include New Jersey Medical Services data. And this data details EMS responses to calls throughout New Jersey. And some of the data elements contained here include location, incident dates and time, type of transport, whether it was by ambulance or helicopter, any relevant medical history, and procedures that are delivered by the dispatched medical response team at the time. So as you can see on the chart, those are the current years, and we're looking to update these as they become available. Some of these have longer lag times than others, but as soon as they are available and finalized on the DOH side, then they get transferred over to our end. Next slide. Some additional sources that are being discussed by the governing board include COVID-19 vaccination registry data, and also the New Jersey enrollment claims and encounter data, which would only enrich our current holdings. Next slide, please. Okay, so before I talk about data linkage, I do want to sort of talk about the pre-linkage process. And again, I do want to re-acknowledge the work that Rick Hall has provided from ChoiceMaker in configuring and setting up the data linkage models for this project. I'd also like to acknowledge the support from the iPHD computing team, which have been working hand in hand. So particularly Jonathan, Sam, Dinesh, and John DeVulo, who put in a lot of work in setting up the isolated environment, transferring of files and configuration. I'm sure they're sick of me. I'm always bugging them with requests, and they've been extremely helpful throughout the process. So as I said before, the actual data linkage and record matching happens, there is this pre-data linkage process that happens, which is the ETL process. So we receive the files from the data stewards, they're sent to us, and what we do is we preserve this raw source data file that is untouched. So we set those aside. We bring in any documentation that are sent by the data stewards, and we do a data contents and run some descriptives. Next, we begin to prepare the files. So we sort of pull out that source file and we begin to add some metadata for our end. And that really describes the data set so that we can manage those files. That includes sort of the data source name, the year of record, and things of that nature. We also generate a universal unique record ID. So this is particular to one row in a giant table. So it's a unique record so that we can track where that record goes and are able to link back to that record throughout the data matching process. Another crucial step is sort of the next step in where we have to create a stacked table, which where we have to standardize and really normalize a lot of these identifiers. So these data sources, as I mentioned before, are coming from they're different types of data. So the fields are not named the same. And even within a data source, there are layout changes. So some of our data goes back to the year 2000 up to present. Throughout that time, there has been some changes to those files. So we have to bring that in, standardize each of those fields so that they can line up. So first name, last name, dates of birth, all of that has to be in a standardized format so they can essentially stack into one file. During that process, we also developed some derived and computing fields. So some examples of a derived field is a soundex, which is a coded index that it's based on the way a name sounds rather than the way a name is spelled. And this, as I'll describe later, is important for the data matching process. We also geocode address at the street level wherever possible against census tiger files. And that allows us to sort of bring in latitude and longitude information and sort of a standardized address that we can match against each other. And then finally, the last step here is a deterministic deduplication. Now, we don't do this initially, but it is something that as you go through the process and you start developing a master person index, you can deduplicate the file. That will reduce the amount of matches you have to do in the next steps. Also, if the data source provides a patient identifier that you can trust, that will also allow you to reduce the number of matches that you have to compute. Next slide, please. So this is an overview of the matching that we're doing with using the ChoiceMaker tool. So ChoiceMaker is a Java-based application that runs against a Microsoft SQL database. And we use SAS to do a lot of the data prep and managing the import files that go into database. But then the ChoiceMaker tool will pull the records from a database. So in this first step here, so Joel, if you can just click, yeah, that's where the input files go in that I described earlier. Once they're standardized, either from a master database or another query record that we're adding throughout the process. The next stage is blocking stage. And this is what we would describe as a fast matching algorithm that puts records into blocking groups. And we are blocking on things like first name, last name, name soundex, year and month of birth, and also the reverse of first name and last name. As you know, like the quality of data can vary. So this initial fast matching is sort of, are these records in the ballpark? And this is used to sort of narrow down the number of records that needs to be processed by like a higher precision later on and more the more computative intensive stages that happen later on. So some of the analogies for this is sort of, when you do your laundry and you're sort of sorting socks, right? So you put them into different color buckets. So something I have my kids doing. So they usually will sort our socks at that blocking stage. And so my younger one to do that, and then my daughter will come later and with more precision and make sure that the socks line up, which isn't always the case if you see me in the office with mismatching socks. But in any case, that is not happening here. We are matching our socks correctly here. So the next stage is the more intensive decision-making stage, and this is based on a maximum entropy model or a logistic regression. And this stage I will describe it in a little more detail with the following example. So after this stage occurs, you get an output file, which is gives you a match probability that really outputs the decision into three buckets: a low probability differ decision, medium probability for human review, and then the match decision, which we think is a high probability the two records are matching here. So next slide, please. And this is where you can then develop your common index and create a person ID for records that match. Next slide. So as I mentioned earlier, the choice maker is built around a set of 50 to 200 clues or features, or what they're sometimes called, for match and differ decisions. And these are made on common names, birth dates, address approximations, things like admission dates, indicator of twins. You can use this on medical record IDs if they exist, insurance IDs, and so on. And this is really saying, like, are our first names the same? Are they common names? Are they uncommon? Are they rare names? Do the last names have like the same soundex? And you know, are birthdays different? So the model is trained, it goes through this training process where it looks at a set of pair records that have been tagged as match, differ, or hold. So there is a human component to this where we train the data. So sets of pairs are pulled out, and members of our team will look at these records and sort of a subset of records, and we'll make decisions on that. And based on the decisions we make, whether or not they match, that goes back into the choice maker tools, and essentially we'll learn from this and try to replicate it with the rest of the data set. So this training process then assigns each of the clues a weight, which is a positive real number, indicating the relative predictive strength of the clue, denoted by that formula listed in the bottom. Next slide, please. So this is a very simple example, just so we can get an idea of it. So in this example here, as I mentioned, so we're trying to see if these two records for Jim Connor are matches or not. So, and you see the fields that are being used here are first name, last name, and soundex last name, which I referred to before, which is a phonetic code of the names. So you see that the first names are the same, and the prediction there is it's a match and a weight is assigned. You'll see that the last names, if you're looking at them exactly, they're different, right? They're off by a letter. And then that's a differ prediction, and it's assigned a weight. But then you see the soundex last name where they're similar, and that is a match, and then that is assigned a weight of 5.5. So based on the formula before, which is the match product, and that is match product over the sum of the match product over the differ products. And given this example, this formula gives us the probability of 79% that Jim Connor with the E and Jim Connor with an O are the same persons. And as I mentioned, the weights are determined during the training by the engine to produce the decision that is consistent with human markings. And depending on the data sources you have, you can adjust these weights as needed. Next slide. So where we are with our matching, so this was our first go around with the initial matching, we have reviewed about 58 million records from our data sources, and this includes about 2.4 million records for birth mothers. So we're evaluating those results and doing more testing before we make a final decision on assigning a master person ID for those that were deemed to be matches. So we'll be creating that master person ID and relevant pseudonymous identifiers or study IDs for limited data sets for the initial 4 study projects. We're also constructing crosswalks for the birth record file to link child and mother. So we'll be able to track a child's mother across the data set as well as the child themselves. We're gonna, like I mentioned, we're gonna continue to improve our matching model as new data is introduced and as we learn more from fields throughout the process. As I mentioned, throughout this, we've learned that, for example, insurance ID could be a good ID to use. Even though you may change insurance, it can allow you, if other things are different and this matches, this may be a match. So we're looking at all sorts of things like that to continue to improve the model.